All right, so this is the torso model. The first feature that I want to point out is part of the digestive system. This salivary gland lies in the cheek, and this is called the parotid gland. And we have another one. This is the submandibular gland, called the submandibular because it is under the mandible. You have a third salivary gland that is not shown in this particular model, and that is the sublingual gland. Sublingual, as you might imagine, would be under the tongue. Saliva does a couple of different things in the body. It does have amylase, which is an enzyme that begins to break down sugars, carbohydrates. But in addition to that, we actually need the saliva to moisten our food into a substance that we call a bolus. And a bolus is a moistened portion of food. This here is the hyoid bone. That's H-Y-O-I-D, hyoid. Now the hyoid bone is the only unarticulated bone in the body. Now even the patella, which is a sesamoid bone embedded in a tendon, still makes contact with the femur. And as you bend your knee and straighten your knee, the patella actually slides across the surface of the femur. This doesn't articulate with any other bone in the body, interestingly. And what this bone does is this assists in swallowing and vocalization more than anything else. So now I'm going to start to take this apart a little bit. So now as we kind of pull some things away, here and here on both sides, that is actually the thyroid gland. The thyroid gland. This structure in the front with these rings is the trachea. The trachea. These rings are the cartilaginous rings of the trachea. And this portion from here to here is all considered the larynx. The larynx. The larynx is where we have our vocal cords. This portion of the larynx in blue in the anterior portion here, that is the thyroid cartilage. And if I turn to the side, here's that thyroid gland again. And this cartilage is called cricoid cartilage. Cricoid cartilage. And those are the cartilages of the larynx. This is the heart. And you'll notice that the heart is off-centered. It's actually slightly off-centered towards the left side. It sits in between the lungs and a little bit nestled behind the lungs. Because the heart is off-centered towards the left, we actually see asymmetry between the right and left lungs. The left lung has the superior lobe and the inferior lobe. And that's it. There's just two lobes for the left lung. The right lung has three lobes. So the right lung has the superior lobe, a middle lobe, and an inferior lobe. Underneath here is the right atrium. The right atrium. On the outside of the heart, we have this structure here, which looks somewhat like the outer portion of the ear. And for that reason, this portion is actually called the right auricle, just like the pinna or auricle of the ear, the right auricle. Underneath the right atrium, we have the right ventricle, the right ventricle. On this side, we have the left atrium and the left auricle and the left ventricle. So you might recall that deoxygenated blood coming from the head, neck, and arms go through the superior vena cava. So this is the superior vena cava. And the superior vena cava is created by the mergence of the right brachiocephalic vein and the left brachiocephalic vein. Brachio meaning arm, cephalic meaning head. Both of the right and left brachiocephalic veins have two branches that make it up. So this would be the jugular vein. This is the left jugular vein and the right jugular vein. This is the left subclavian vein, and this is the right subclavian vein. They're called subclavian because they travel underneath the clavicle. This is actually the clavicle here and here. All right, so deoxygenated blood comes from the right and left arms through the subclavian veins. So the jugular vein and subclavian merge to the brachiocephalic veins. It's the left brachiocephalic, right brachiocephalic. Right and left brachiocephalic veins merge together, forming the superior vena cava. Blood coming from the lower portions of the body, including the legs and the torso, are going to return to the heart through the inferior vena cava, which is here, the inferior vena cava. This here is the pulmonary trunk, the pulmonary trunk. This is the aorta. So now I'm going to take off this front portion here. So blood is going to come from the left subclavian vein and right subclavian vein. They're going to merge with the left jugular vein and right jugular vein to form the right brachiocephalic vein and left brachiocephalic vein. The right and left brachiocephalic veins merge together to form the superior vena cava. That blood drains into the right atrium. Blood from the lower portions of the body enter the right atrium through the inferior vena cava. Once blood is here at the right atrium, it can then travel into the right ventricle, which is here. It travels from the atrium to the ventricle through the tricuspid valve, which is here. Now the tricuspid valve have these little strings on them. And if you guys ever heard the term, you're pulling on my heartstrings, this is actually where you get that saying from, because we actually do have strings. These strings are called the Chordae Tendineae. The Chordae Tendineae. Now, the Chordae Tendineae are going to be attached to muscles here called the papillary muscles. Now, what the Chordae Tendineae and the papillary muscles do is they ensure that this valve opens in one direction but not the other. It's a one-way valve. So the valves prevent backflow of the blood so that blood flows in one direction through the heart. Once blood travels through the tricuspid valve and is in the right ventricle, I then get a contraction from the cardiac muscle or myocardium, and that's going to slam this door shut, and it's going to open the pulmonary semilunar valve here. So the pulmonary semilunar valve is going to be the opening to the pulmonary trunk. All right, this is the pulmonary trunk. The pulmonary trunk is an artery, blood vessel that's going away from the heart, yet it's colored blue because it is carrying deoxygenated blood. Here's the pulmonary trunk. The pulmonary trunk is going to split off into the right and left pulmonary arteries. The right pulmonary artery is going to feed the right lung. The left pulmonary artery feeds the left lung. At that point, there is exchange of oxygen and carbon dioxide, and now the blood is oxygenated. So oxygenated blood from the right lung is going to travel to the left atrium through the right pulmonary veins. Oxygenated blood from the left lung is going to travel to the left atrium through the left pulmonary veins. And these pulmonary veins are colored red because the blood is oxygenated in that blood vessel. Once the blood is here at the right atrium, it will then travel through the bicuspid valve, better known as the mitral valve. The mitral valve. Blood can then go through the mitral valve or bicuspid valve and enter into the left ventricle. Now, the left ventricle is the most muscular and the largest chamber of the heart. When this contracts, the mitral valve is going to close. This is the aortic semilunar valve, or simply the aortic valve. The aortic valve is going to open, allowing for blood to enter into the aorta. The first branches of the aorta are actually going to be the right and left coronary artery. The coronary arteries provide the blood supply to the tissue of the heart itself. When we look at the outside here, this here is the right coronary artery. This portion just right here, before it splits, you'll see it splits right here, but just this portion, right at this point, this is the left coronary artery. Now the left coronary artery is going to split right away. One branch is going to go in between the ventricles and it's going to continue anteriorly. This artery is called the anterior interventricular artery. The other branch is going to circle around and continue to the back portion of the heart. This branch is called the circumflex artery. The circumflex artery. So if I continue to follow the circumflex artery around, that leads me to the back of the heart here. This vein here, this is called the coronary sinus. The coronary sinus. This portion is considered the ascending aorta. The ascending aorta. Now, once I get to the point where I see these ascending branches, this is now considered the aortic arch. The aortic arch. Now, the aortic arch has 3 branches coming off of it. The first branch is the brachiocephalic trunk. The brachiocephalic trunk. The brachiocephalic trunk is going to bifurcate or split to the right common carotid artery and the right subclavian artery, which you can just see a little bit of it here. Okay. The second branch, which you can see a little bit more of here, is the left common carotid artery, and that continues here. So, and the third branch is going to be the left subclavian artery. So this is the trachea, the trachea, the trachea. So here's the trachea. Behind the trachea, you have the esophagus. So here's more of the esophagus here. At this point here, the trachea splits. Trachea is going to split into the right and left primary bronchi. Bronchus would be singular, bronchi would be plural. So the right and left primary bronchi. So remember, this is the ascending aorta, the aortic arch. After the aortic arch, it's going to turn and descend. At that portion, generically, we call this the descending aorta, but I want you to be more specific than that. The portion of the descending aorta that is in the thoracic cavity is the thoracic aorta. Below the thoracic cavity, the aorta is going to continue to descend and become the abdominal aorta. And we'll see that a little bit when we peel more of this guy open. You might recall from the beginning of class that the diaphragm is physical separation of the thoracic cavity and the abdominopelvic cavity. The diaphragm is the principal muscle of respiration. When you are resting or asleep, your breathing should be governed almost completely by the diaphragm. When you're stressed or working out, that's when we start breathing from our intercostal muscles. So again, this is the diaphragm. This here is the liver. This is the stomach. This is small intestine. And in gray, this is the colon, otherwise known as the large intestine. So I'm going to remove the diaphragm now. And now I can see the liver. Now, the first thing you might notice with the liver is this blood vessel here. This is the inferior vena cava. If I flip this around, I can see more of the inferior vena cava. In green, this is the gallbladder, Now, the liver, the main thing that it does, it is going to create bile. And that bile is ultimately going to go to the duodenum, which is the first portion of the small intestine. What the gallbladder does is the gallbladder is going to take the bile that's made in the liver and it's going to store it and concentrate it. What it does is it waits until it gets a signal from the digestive system saying that there is fatty food coming down the pipes. When there's fatty food coming down, that triggers the release of this super concentrated bile, and it gives that 1-2 punch. What bile does is it's going to do what we call emulsifying fats. It cuts the fat up into smaller pieces, smaller oil bubbles, if you will, so that the other enzymes can then go around and get at the nutrients and break it down. So this is the gallbladder, and this is the cystic duct, the cystic duct. This is the hepatic duct. Okay, so hepatic duct, cystic duct, when they merge together, then we have what's called the common bile duct, the common bile duct. Now, the common bile duct is going to continue right here where it's green. And that common bile duct is going to enter into this structure here called the pancreas. The pancreas makes pancreatic enzymes. So we've got pancreatic enzymes and bile, and all of that is going to go to the first portion of the small intestine, which is here at the duodenum. Here we have our esophagus. Food is going to come down the esophagus, and it is going to go through a valve in order to enter the stomach. So I could ask you about this valve at this location or at this location. Both of these are the cardiac valve, also known as the cardiac sphincter. Either one is okay. Now, the reason it's called the cardiac valve or the cardiac sphincter is because if this is all articulated, you'll notice that it's close to the heart. The heart sits right here. Food is going to enter the stomach through the cardiac sphincter. In addition, I have another sphincter or valve that food must exit the stomach from, and that is here and here. And this is called the pyloric valve or pyloric sphincter. So now I have the stomach open, and here is that cardiac valve. On Thanksgiving, if you eat too much food or spicy food, what can happen is the cardiac valve will not close all the way. When that happens, we get acid reflux or heartburn. And the stomach acid, which is hydrochloric acid, is actually going to go up and back into the esophagus. Now, the esophagus does not have the structure to combat the hydrochloric acid of the stomach. So that will burn this and can actually cause damage. So this is the cardiac valve. The area around the cardiac valve is called the cardiac region of the stomach. The cardiac region of the stomach. This bulge here is called the fundus or the fundic region of the stomach. The main area of the stomach here is called the body of the stomach. And as I approach the pyloric valve, this would be the pyloric region of the stomach. The last structure you need to know are these ridges. These ridges are called rugae. The rugae, and they allow for expansion of the stomach. So this is the pyloric valve or pyloric sphincter. Now, the pyloric valve or pyloric sphincter is the moistened food is called a bolus when you swallow it because it's moistened enough to swallow. That bolus, once it enters the stomach, it undergoes processing until it becomes a new substance called chyme. Until it gets to that right consistency of being broken down in the stomach, this remains closed. So this is going to open only when it senses that it's at that right consistency in which we call chyme. Food is then going to begin to enter the first portion of the small intestine. The first portion of the small intestine, this portion is the duodenum. It is the shortest portion of the small intestine. Now here at the duodenum is where most of the digestion of the food is going to take place. Now the reason for that is because this is now chyme, but this chyme is now going to get pancreatic juice or pancreatic enzymes from the pancreas, and they're going to drain directly into the duodenum. In addition, the bile from the gallbladder and the liver are also going to drain here into the duodenum. So because of the bile and because of the pancreatic enzymes or pancreatic juice, we're going to have most of the digestion occurring in just this area here. So this structure here is the spleen. This is the spleen. This is the right kidney, And this is a portion of the left kidney. Can't really tell, it's really dark. Okay, and then there's the rest of the left kidney. Urine from the kidneys is going to travel to the bladder. So this is the bladder, and how it gets from the kidneys to the bladder is through the ureters. So this is the right ureter and the left ureter. The abdominal aorta, you can only see a little tiny bit of it here. It's going to continue behind these. So once food is moving through the duodenum, it's going to go through the jejunum, which is the second part of the small intestine. The jejunum is going to be most of this yellowish area here on this side and on the top of this. Absorption of the nutrients occurs mostly in the jejunum of the small intestine. Now, there's no physical separation between the jejunum of the small intestine and the ileum of the small intestine, but the ileum of the small intestine is going to be around this structure here. So in order for food to go from the ileum to the large intestine or colon, it has to go through a valve. That valve is called the ileocecal valve. Ileocecal valve. It's another structure that's hiding back here. On the back portion of the cecum, this is the appendix. The appendix. Now, the appendix was thought for a long time to be just what we call a vestigial organ, meaning that it has no use whatsoever anymore. But now we're kind of thinking that this has some probiotics. This used to create enzymes for digesting cellulose. Now the colon has different regions. The first region is the cecum. This portion is the ascending colon. The ascending colon. Here on top, this is the transverse colon, and then the descending colon. Now, once I get to about here, it's going to continue on the model. This portion is called the sigmoid colon. It's called the sigmoid because it makes kind of this weird S shape. Now, sometimes doctors will do a full colonoscopy and look at all of the colon. Other times they might just order a sigmoidoscopy.